is the Emergency Medical Minute.
Okay, a couple days ago, saw a patient that was sent from an outpatient MRI scanner for a burn, a second-degree burn. And if you looked at the patient, there was a blistering, what looked like a blistering burn over her hip. So kind of an unusual patient to see, but second-degree burns and mild first-degree burns and thermal burns have definitely been documented from MRI. I haven't seen one before. So we always think about the problems that happen with the magnets, but there is a lot of heat generated with the machine from the radiofrequency. We think of MRI being one of the safer modalities of imaging, but there's several case reports of burns that can occur. So the less typical type of injuries that can happen can be from, say, anything that contains metal, like EKG stickers. They've been documented in people who've had patches still on, like a fentanyl patch or some other patches, certain medication. They've been documented in people who are wearing clothing that's impregnated with metal ions. So, like some of the kind of odor protective clothing that people buy these days with silver ions could do it as well. Theoretically, people have reported that they think it could happen if people wore that clothing, took them off, hadn't washed enough, and they could get burns as well. But more commonly, it happens from improper positioning, where a cord or a grounding cord or an electrical cord isn't properly insulated, and so that's why they're so careful in positioning patients. But the most interesting case reports, I think, that I had no idea, is actually from skin-to-skin contact. So one of the reasons they position people so carefully during MRI is sometimes with certain skin-to-skin contact, you can create a closed-loop circuit, and the machine reads it as a really thick piece of tissue. It gives increased radio frequency, and because of that closed loop in certain situations, there's been burns documented, and people have had blistering second-degree type burns for it. So just kind of an interesting FYI, and another one of the reasons why MRIs seem to take so long when we get them. So, okay.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.